Most women expect a missed period or morning sickness as the first signs of pregnancy. But the truth is, your body often whispers the news much earlier. In this video, I'll show you the 5 earliest pregnancy symptoms, backed by science, that can appear before your period is even late. Some of these signs are subtle and often mistaken for premenstrual syndrome, but once you understand them, you'll be able to recognize the difference. So let's dive in. 1. Implantation bleeding and cramping. The very first real sign of pregnancy happens at the moment of implantation, when the fertilized egg attaches to the uterine lining. Implantation bleeding. This occurs in about 25 to 30% of women. Unlike a period, it's usually light spotting, pink, brown, or rusty in color. It lasts only a day or two and never becomes heavy like a menstrual flow. Implantation cramps. These are often described as a tugging, pinching, or pulling sensation low in the abdomen. Unlike menstrual cramps that are rhythmic and strong, implantation cramps are milder and shorter in duration. This happens because as the embryo burrows into the endometrium, small blood vessels break and release a tiny amount of blood. What is the key difference from premenstrual syndrome? Premenstrual syndrome cramps come just before or with the period and grow stronger. Implantation cramps usually happen 6 to 12 days after ovulation, which is earlier than the period. For trying to conceive women, if you see light spotting earlier than your expected flow, don't dismiss it as an odd cycle. It could be your very first pregnancy sign. 2. Basal body temperature stays elevated. For women who chart their cycles, this is one of the most reliable silent signs of pregnancy. After ovulation, progesterone rises, keeping your basal body temperature (BBT) higher than normal. In a non-pregnant cycle, progesterone drops after about 12 to 14 days, and your temperature falls right before your period starts. But if conception occurs, progesterone remains elevated, and your basal body temperature stays high beyond day 14 of the luteal phase. Some women even notice a triphasic chart, a second small rise in temperature a few days after implantation. Why this matters: basal body temperature tracking is especially helpful for women with irregular cycles, because the sustained temperature rise is an early clue before you can even test positive. Difference from premenstrual syndrome: with premenstrual syndrome, temperatures always drop at period onset. In early pregnancy, they remain elevated. 3. Cervical mucus and vaginal changes. This is one sign most women overlook, but gynecologists and fertility specialists often use it as a clinical clue. In a normal non-pregnant cycle, cervical mucus becomes dry or sticky right before the period. But in early pregnancy, rising progesterone and estrogen cause cervical mucus to remain creamy, thick, or lotion-like instead of drying up. Some women describe a wet feeling or increased discharge that continues past ovulation. This happens because estrogen promotes mucus production, and progesterone keeps it thick to create a protective plug at the cervix. Other subtle changes. Some women feel vaginal tissues becoming slightly fuller or more sensitive. A heightened sense of vaginal lubrication, different from premenstrual syndrome dryness. How to differentiate it from premenstrual syndrome? PMS discharge is minimal to none. Persistent creamy discharge beyond ovulation is often a pregnancy clue. 4. Breast and nipple sensitivity. Breast changes can happen shockingly early, sometimes within a week after conception. Fullness and heaviness. Many women describe a different kind of breast soreness compared to premenstrual syndrome. It feels deeper, heavier, and lasts longer. Nipple sensitivity. Nipples may feel tingly or extra tender, especially to touch or clothing friction. Areolar changes. Some women notice the areola becoming slightly darker or bumpy earlier than expected. Why does this happen? Rising progesterone and early HCG stimulate increased blood flow and ductal changes in the breast tissue. Difference from premenstrual syndrome: PMS breast pain is usually generalized and resolves once the period starts. Pregnancy-related changes are more persistent and progressive. Here's a tip for you: if you feel soreness that doesn't fade after your expected period date, it's time to consider pregnancy testing. 5. Unexplained fatigue and emotional shifts. Fatigue is one of the most underestimated earliest signs of pregnancy. Extreme tiredness can begin as soon as implantation occurs. Women often describe feeling drained or needing naps despite sleeping well. This is because progesterone rises sharply, which has a natural sedating effect on the brain. At the same time, your body is diverting energy to build new blood vessels and support the embryo. Mood changes, emotional sensitivity, crying more easily, or feeling different emotionally can also appear. This is not the same as premenstrual syndrome irritability. It's usually described as being more emotional or sensitive. Difference from PMS: premenstrual syndrome fatigue is mild and short-lived. Pregnancy fatigue feels like a wall hits you, even during normal activities. So there you have it, the 5 earliest pregnancy symptoms before a missed period: implantation signs, a sustained rise in basal body temperature, changes in cervical mucus, breast and nipple sensitivity, and sudden fatigue with mood shifts. Each one on its own may be easy to dismiss as premenstrual syndrome. But together, they can give you a strong clue that pregnancy has already begun. If you found this video helpful, make sure to subscribe and turn on notifications because in our next episode, I'll be sharing how to tell the difference between PMS and pregnancy symptoms with confidence. See you then.